A new category of intake values has been added to the dietary reference intakes, called the Chronic Disease Risk Reduction Intake, or CDRR. This new DRI category characterizes nutrient intake levels that are expected to reduce chronic disease risk. In general, the CDRR is set when there's at least moderate strength of evidence for both a causal relationship and an intake-response relationship between nutrient intake and chronic disease risk. For potassium, there is evidence that potassium supplementation reduces blood pressure, particularly among adults with hypertension. Across studies, though, there is not evidence of a greater blood pressure reduction with higher potassium supplementation. This means there is not an intake-response relationship in the body of evidence, which is a key piece of evidence needed to establish a CDRR. Less is known about the relationship between potassium intake and chronic disease endpoints, like cardiovascular disease and kidney disease. The body of evidence is not yet of adequate strength to establish a potassium CDRR, so none is given at this time. Does this mean that potassium doesn't have an effect on chronic disease risk? Not necessarily. It just means that more evidence is needed in order to be able to characterize how chronic disease risk changes over a range of potassium intakes.